So joining us to shed some more light on this important subject is Melanie Dowell from GBMC, also known as Lanny. Welcome, Lanny.
Thank you so
very
much.
Thank you.
We talked about this. This is a very important conversation.
It is, absolutely.
Yeah, so talk to us about the difference between postpartum depression, postpartum stress, and postpartum anxiety.
So postpartum depression is fairly common for new moms. The differences between really going from, well, everyone has stress. You have a baby, you have stress. You really can't not have stress when having a baby. But depression really becomes more withdrawn behaviors, and you get to a point where you just feel like you're not bonding, you don't want to bond, you are not comfortable. It's more than baby blues. Most moms experience at some point in time some blues, but when you really sink into that depression, it's wanting to sleep a lot, not wanting to eat, not keeping up with your regular hygiene patterns, everything else, just kind of withdrawing and wanting to be in a cocoon. And unable to take care of everything.
So you mentioned some symptoms. Let's dig deeper into that.
Sure. Symptoms would be when it comes to a feeding time, a mom saying, you know what, could someone else just feed the baby? I don't want to hold the baby. I don't feel like I want to comfortably interact with family, friends, with my baby. I don't feel confident in the process. This is not what I expected.
Gotcha.
So those are kind of some of the normal feelings when moms start really entering into that postpartum depression phase. Anxiety is going to be very different from that. Anxiety is a mom who is not able to sleep. She's up cleaning all the time, checking on the baby. It almost becomes like an obsessive compulsive, I can't not do something. I have to be doing, I have to be on all the time. And there's no downtime. Eating and sleeping is not a priority for her. And constant worrying, constant fear.
So how long does these conditions last for?
It varies. There are, I think the misunderstanding or the average in families, they think it's right away. You're going to get postpartum depression and you need to be right on top of it. You need that immediate family in there, which is great, which is definitely what we want. But it's a lot of times when family leaves and you don't have that support in place that we start seeing it sneak in. Husbands go back to work, partners go back to work, and you're there with a newborn and you're trying to figure it out. So 3 months, 6 months, up to a year, we've seen it later than that. It is not an immediate onset. And for some people, they tinker with it a little bit. They feel it, but it really doesn't present itself till later on.
I see. So are there any risk factors that could increase a new mom's chances of developing something like postpartum depression or anxiety?
The greatest risk factors are moms that have a pre-existing history of any type of mood disorders, whether it's normal depression that they've been dealing with, anxiety, OCD, any type of level, any level really of depression issues. I think also not having family close by is one of the biggest problems for families, because so many of us are transplants and so many new families coming to deliver, they don't have people in the area to help care for them and the baby.
So is there anything that new moms can do to kind of alleviate those symptoms or even prevent it from the offset?
Absolutely. We spend 9 months planning for one big day. And we really need to look at those days afterwards, the immediate 2 weeks, and really up to a 6-month time period, and then have that touch base person. So if you've been working with a therapist, continue working with the therapist. If you've been taking medication, continue with the medications. If you, all of a sudden, this becomes a stumbling ground for you, there are programs out there. There are support programs out there, not just medical treatment, but the doula program, hiring somebody that's key that will be in place that comes and does infant care, sibling care, meal preparation. They'll walk in at 10 o'clock at night and say, I've got the baby. If you're breastfeeding or bottle feeding, however you want to work this, we'll work it with you. But having that extra set of hands and just having someone to talk to and share what this experience is for you.
Right, so if you don't have that community, creating it for yourself.
Create the community, hire someone to clean your house, hire a pet sitter, but put people in place for even the things you think are small items become big tasks once you've had a baby.
And this is so important because we need this flow of communication because so many women are struggling with this issue. How about lifestyle changes? Are there any things that we can implement?
I think signing up for support classes, workout classes are fantastic. There are so many mommy and me yoga programs, mother support groups. Moms will meet, they'll have a cup of coffee, take stroller rides, go to the farmers markets together. But putting yourself out there, meeting people, when you start feeling like I want to withdraw, that's the time that you need to have that conversation with people and say, I feel this. If you see this, make note of it and help me seek the resources that I need to seek, because we can't always be our own advocate. We need other advocates for us.
Absolutely.
Definitely.
And I'm sure even things like making sure to give yourself time to take that bath or that shower.
Absolutely.
You know, have that cup of tea.
Have
Just sit
me
down
time.
for 5 minutes.
And that's it, plan. You know, girlfriends, family will always say, I can be there for you. Tell me when you want. Take advantage of it.
Yes, delegate.
Bring all the meals, you know, schedule. But make schedules. Don't have it so that all of a sudden you have 10 things of chicken casserole on the first day home. Let people know, I would love to have a weekly planning, or could someone volunteer to help with these key things? Setting that in place. And if you don't need it, you don't need it. It's easier to say no than to look for it when you're in a struggling point.
Well, this was a very useful and important conversation. Where can our viewers find more information?
Viewers can always go to www.gbmc.org/parent-ed, and there are support programs, amazing classes, the Doula program I would strongly recommend for anyone.
Lanny,
Thank you so much.
Thank you so much.
Great. Have a rainy Thursday.
I know.
It'll clear up soon enough.
Exactly. Okay, guys, up next, where you can taste the islands all year round. You know, I'm excited for that. Caribbean Masters right here.
Oh, yeah. And if you are single and ready to mingle, we have got a new but familiar place for you to find a hot date. Stay with us. You're watching BMORE Lifestyle. We'll be right back.